Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for patients, families, and parents. Please remember this video is not intended to replace visits to your physician. If we can be of assistance here, give us a call at 775-359-7111. This video today is actually in response to a question posed to me by someone who goes by the name of Super Toy Hunter. And they posed it here on YouTube, so I'm replying. I went to reply to Super Toy Hunter in private. Unfortunately, your privacy settings were set in a way that I can't send you a reply, so we'll send you the video. Hopefully you find it. In this question that Super Toy Hunter presented, he or she presents to me a case of a patient who is having some bizarre behaviors. And came at a neighbor with a knife. The patient is unkempt, is dirty, has scratches and abrasions all over their hands, and is brought to the emergency department where they're being monitored. And the question specifically is, what are three concerns we have for this patient over the next 24 hours? And in response to Super Toy Hunter's questioning and the way the question was written, I do agree with the three things that you were concerned about, and that is, with a patient like this, we would be concerned about the possibility of, to use your term, absconding. The medical term we use here in the United States is elopement, or leaving without permission, and trying to be lost to follow up. Number two, potential of harm to yourself and potential of harm to others. The patient that was described is described as saying something to the effect of, they're monitoring all of us, they're watching us, don't you know it? The patient is either a paranoid schizophrenic, or is under the effect of illicit substances and having a psychotic episode as a result of those illicit substances. Either way, this patient is definitely, because they came at a neighbor with a knife, and they're clearly very agitated, they are a risk to themselves, they're a risk to others. Here in the United States, such a patient would be placed on a 72-hour psychiatric hold while we evaluated to see if they were safe to return back to society, at which point in time they would be brought in front of a judge and a hearing would be processed, and a determination would be made whether it was safe to release them back to society or whether they could be held for an additional length of time while more psychiatric evaluation is done. In the state of California, where I trained, this would be a hold under California State Penal Code Section 5150, and so it's referred to as a 5150 hold. Here in the state of Nevada, this hold would be called a legal 2000 hold, but the idea is kind of the same. Criteria for a 5150 or a legal 2000, a 72-hour psychiatric hold, there are really three. Risk to self, so potential harm to self, danger to others, and severely emotionally disabled. And to be severely emotionally disabled, you need to be unable to provide food, clothing, and shelter for yourself. This patient's clearly a potential harm to self and a potential harm to others, and so in the United States would be qualified for a 72-hour psychiatric hold. So as far as three major concerns for the patient, yes, the risk of elopement, which is why we would place them on a hold where they wouldn't be allowed to leave, and that 72-hour psychiatric hold in the United States would give us the right to restrain the patient either physically or chemically, or both if necessary. So that would alleviate your risk of elopement. We would place the patient on a hold because he's clearly a danger to self or others, or self and others. Now, take all of this with the caveat that I am a general pediatrician. I do a lot of behavioral health in my patients and a lot of developmental pediatrics. I am, however, not a psychiatrist, and nor am I an expert in substance abuse. So take these comments for what they're worth. This is Dr. Kevin M. Windisch. I hope this has been enlightening, and I hope this answered your questions. Can't remember your name now, Super Toy Hunter.